A complete guide, 2025 updated. Every minute counts when treating sepsis. Would you know what to do? In this video, we'll walk you through everything from recognizing early warning signs to managing severe cases in the ICU. Sepsis is a medical emergency that affects millions worldwide, with a high mortality rate if not treated promptly. Early intervention can mean the difference between life and death. We begin by understanding what sepsis actually is. It's a life-threatening organ dysfunction caused by a dysregulated host response to infection. The body's response to an infection can trigger widespread inflammation, leading to tissue damage, organ failure, and sometimes death. This video will cover how to recognize, diagnose, and treat sepsis effectively using evidence-based hospital protocols. Let's start with the pathophysiology of sepsis. When a pathogen enters the bloodstream, the immune system activates a powerful inflammatory response. Cytokines and inflammatory mediators are released, triggering a cascade that increases vascular permeability, lowers blood pressure, and impairs oxygen delivery. This process, often referred to as a cytokine storm, can rapidly progress to multi-organ dysfunction. We'll explain how this immune dysregulation leads to damage in key systems like the kidneys, lungs, and brain. Recognizing sepsis early is critical. Key symptoms include fever or hypothermia, increased heart rate, rapid breathing, confusion, and low blood pressure. Tools like the SOFA, Sequential Organ Failure Assessment, and qSOFA, qSOFA, scores are used to assess risk and severity. Diagnostic workups include complete blood count, metabolic panels, blood cultures, urinalysis, and lactate levels. Elevated lactate is a strong indicator of tissue hypoperfusion and correlates with worse outcomes. Initial management, often referred to as the golden hour, is vital. The Sepsis Six bundle includes 6 tasks to be completed within 1 hour: giving high-flow oxygen, obtaining blood cultures, starting broad-spectrum 4 antibiotics, administering 4 fluids, 30 milliliters per kilogram crystalloids, measuring lactate levels, and monitoring urine output. Time is critical. Each hour delay in antibiotic administration increases mortality. Antibiotic selection depends on likely source and patient history, but should always be broad-spectrum initially. Commonly vancomycin plus piperacillin-tazobactam or cefepime. Blood culture should be drawn before antibiotics, but without delaying treatment. Lactate should be rechecked within 2 to 4 hours to assess response to resuscitation. Crystalloids are the fluid of choice. Avoid colloids unless specifically indicated. As sepsis progresses or fails to respond to initial measures, advanced interventions become necessary. If hypotension persists after fluids, initiate vasopressors. Norepinephrine is first line to maintain a MAP, mean arterial pressure, greater than or equal to 65 millimeters of mercury. If norepinephrine isn't enough, add vasopressin or epinephrine. ICU-level care may be required, including intubation for respiratory failure or continuous renal replacement therapy, CRRT, for acute kidney injury. Central line placement is needed for vasopressors, and invasive monitoring is used to guide fluid and drug titration. Source control is another critical component. Infected devices or catheters must be removed, abscesses drained, and surgical debridement performed if needed. Monitor organ function closely with daily labs, imaging if indicated, and careful tracking of fluid balance, oxygenation, and mental status. Continuous reassessment is essential. After stabilization, we move into prognosis and prevention. Recovery varies by patient, depending on severity, age, and comorbidities. Predictors of mortality include persistent hypotension, high lactate, and multi-organ failure. Early rehab and nutritional support improve long-term outcomes. In-hospital strategies for sepsis prevention include hand hygiene, early infection identification, and appropriate antimicrobial stewardship. To summarize, recognize sepsis early, act fast, use the Sepsis Six in the first hour, start antibiotics and fluids without delay, monitor closely and escalate care as needed. Every intervention in those first few hours can save a life. If you found this video useful, consider sharing it with your medical team or peers. Train often, stay alert, and remember, know the signs. Act fast, save lives.